This government meeting is brought to you by Eastworks and our local cable subscribers.
I'll call the meeting to order on October 18th at 5:31.
I second that motion. All in favor? Maggie,
Amy.
yes.
Beth, yes.
Okay, so I'm not going to do public speak time since there's no public, unless somebody feels they really need to. So did Amy and Beth get a chance to look at the minutes from last time?
Yes, I did.
Anybody have any questions, concerns? Me either?
Nope.
So we can vote to approve.
I'll make a motion to accept the meeting minutes from the last Board of Health meeting. And I don't remember the date. I'm sorry.
9/20/23.
9/20/23.
I second that motion. All in favor, Maggie, yes.
Amy,
Beth, yes.
Okay.
Okay. So Allison, it's your show.
All right, thank you. So I know you all have a written copy of the update, but I'm just going to run through it sort of as it played out. Starting with hiring and staff updates, I want to welcome Christine here. We can talk a little bit more about her background in a little bit, but Christine is our new public health nurse. She has some good experience as a public health nurse for another region. And I thought it might be nice for us all to sort of go around and do a little bit of introduction, and then we can talk a little bit more about public health nursing program and her background further down in the agenda. Christine, do you want to start and just introduce yourself?
Sure. I'm Chris Southworth. I live in Southampton. I just recently worked at Southwick Regional, a lot of the lower hill towns. Did that for about a year. And before that, I did occupational health and employee health and wellness programs through Mass Mutual. And then the typical nursing, like, you know, the hospital, the home care, some nursing homes, that kind of experience. And I love the public health nursing because I feel I'm really a strong advocate for prevention. And I think this is like the best place to utilize my skills and also like kind of help the whole community stay well, which is passion.
Great. Welcome.
Thank you.
I think you already know me, so just leave it to Amy and Beth. And you must know Jackie and Brian by now, right?
I do.
Yeah. So
Thank goodness.
I can go first. I'm Amy Petrosky. I spent over a decade at local public health in various positions in Western Mass. I think we probably have overlapped once. I was in East Longmeadow, and I think we spoke a couple times. But now I work for the Department of Public Health, working to set the performance standards and create a statewide data system to help support local public health.
Wonderful.
Beth?
My name is Beth Rist. I apologize that I'm not on video, but I'm driving, but I will be home very soon. But I am a physician assistant at Bay State. I've been a PA for about 15 years and a resident of Easthampton for most of my life. So I joined the Board of Health as a way to give back to my city and, hopefully apply some of my medical knowledge in certain situations. But I've definitely learned it's a lot about a lot of other things as well. But welcome.
Thank you.
Thanks everybody for those introductions. Let's see. So we are starting the interview process for a new Easthampton Healthy Youth coalition coordinator tomorrow. We're doing the first round of initial interviews. Maggie is joining Emily Russo, the HR director, and myself to begin that process. And, you know, we had a really diverse candidate pool. We had, I want to say 10 applications when I first reviewed applications with HR a couple of weeks ago, which is actually more than we anticipated. And I know we've gotten a couple more since, so we're going to review the new resumes tomorrow as well to see if there's anybody additional we'd like to interview. Let's see here. So our social worker, Liz Kloos, is returning part-time from maternity leave. So she'll be with us remotely 20 hours a week through December 1st, and then starting again back full-time, potentially still on like a hybrid work schedule to ease back in. Let's see. So I'm not sure what the official outcome will be from the city council meeting tonight, but so far things are looking very good for us hiring a part-time health inspector, an additional part-time health inspector. It went to city council, then it was moved to the ordinance committee, and now, which was approved, the position was approved there, and then pushed back for final approval to city council tonight. So we should know tomorrow, basically, if the position can move forward, and then we'll work, to get that job description posted, the salary range determined, and listed for candidates. I think this might be a tough position to fill. So if you all know anybody in the community who might fit sort of that role or be interested in learning, the field of health inspection, this is a really good way for somebody to get, their feet wet in local public health inspection, code enforcement, stuff like that. So it'll be a really good starting point for somebody. And I know Amy too, with the workforce, the professional workforce criteria now, should we primarily be looking for somebody who has a Bachelor of Science for this position, or since it would just be a part-time, just because I'm a little bit new to understanding the requirement, just should we plan for this person to eventually be an RS?
Well, that's a great question. So the performance standards does not differentiate between full-time or part-time folks in terms of the need to meet the performance standards. Right. Understanding that it might be hard to find someone with an RS who's willing to accept a part-time position, which is one of the reasons why working collaboratively with some of the other communities, it might be a really great approach to hiring this staff person, because people are more likely to take a full-time or benefited job. So I would highly suggest talking to area communities before we post on our own to get that part-time person.
That's a great suggestion. Thanks.
Yeah, and I know we're in the Northampton shared service arrangement, but I don't know what capacity they have or don't have for sharing a part-time staff. But I know they're hiring. So maybe if they're hiring a part-time and we're hiring a part-time and we already have that fiduciary relationship with them, it might be an easy fix. Also, it adds redundancy and other benefits. But if we are going to hire someone, so what really we could do is hire someone with a plan in place. So if you were hired to this position, there are these workforce standards that were put in place on October 11th. We would need you within 5 years of hire or whatever the case may be for that certification to be able to achieve this. This will be a condition of your employment. Are you willing to accept that? So really we know we're not going to find anyone who wants a part-time position at an RS, but ensuring that they qualify for their RS, that they could qualify for their RS and that they're willing to achieve that level of certification is, I think, kind of the best step here.
Great. Thank you. So that's exciting. I mean, we absolutely need that capacity. And I'm also in the training program, working with Bree at FERCOG, to study for and get my RS within this year. So I'll be taking the exam, I think in the spring, but there's a training course that we got a grant for me to go through to do the training course, study program, and then.
Oh, great. Good.
Yeah. Yep.
That's awesome.
All right. Yep. And yeah, it's all great. And so also something that happened in the last month, which Brian, it feels like it's been a century since it happened, but our animal inspector resigned. Kyle Kinlock is no longer working with the city. He resigned with zero notice, with sort of in a little bit of a heated manner. I'm not really sure what was behind it. He told Brian and I sort of like different things. But from what I understand, ultimately it was sort of like there were systems in place at one point that like weren't communicated to me or really kind of continued on in the department. And also it was just like a very busy rabies and bite season. And it was overwhelming. So I don't know. He told me that it was because he was selling his mom's house and he was selling his house. And then there was just like some expectations on his end that was communicated to Brian that weren't being met. So I don't know. It was kind of a confusing and strange occurrence.
So do we have an ACO or animal inspector right now? So did we have the both? ACO was he the animal inspector and the animal control officer?
So animal control is contracted out through Westfield Animal Control. Not Brian. Kyle primarily took care of the animal bite follow-up. He just has the animal inspector, animal bite follow-up, and then barn inspection. Brian.
And how many
bite reports?
How many? I'm sorry, Amy, there was like some interference with the volume.
So all he did was the bite reports and the barn book.
Yeah.
Yes.
And it was a $5,000 a year stipend. And from what I understand in the past, it's been like a sufficient amount of money, but in the past couple of months, we've had, I don't know why, but a significant number of bites and quarantines. And he said that it just wasn't worth it to him anymore for the stipend. So I don't know. So now Brian has basically taken on doing the rabies and bite follow-up. And we have an applicant for the position. Hopefully that will be able to come on board.
If not, let me know. I know someone who is qualified.
Oh, great. Yeah, Amy, absolutely. So I
don't know if she'd be interested,
what's that?
I don't know if she'd be interested, but she's qualified.
Okay. We might be talking about the same person. That Bree also recommended somebody to us that I think is the person Emily from HR and I are going to discuss tomorrow. But yeah, I don't know. Brian, did you want to add anything to that?
No, I don't have not much about Kyle's exit. I do have a animal control certification or animal officer certification. So I've been taking on the rabies bites and just like a quarantine follow-up and responding to that. Fortunately, knock on wood, we haven't had too much recently. Hopefully, with the colder weather coming in, that starts to die down. Yeah, I know ultimately just the big thing that we need to hopefully, we can get somebody in here and get going on the barn inspections. Yeah, just because I don't mind doing the rabies thing, but there's no realistic way for me to squeeze in the barns inspections into my kind of schedule at the moment as well. So
Yeah.
Brian, just to clarify, you're an animal inspector or licensed
yeah,
animal?
that's
Okay.
what I meant. Yeah, I apologize. I said the wrong title. I have an animal inspector certification. Prior to Bree leaving, right before she left, she was like the backup. She had a certificate as well, and she wanted me to get one to serve as that backup as well in case like Kyle went on an extended leave. But yeah.
She was always thinking, aren't you glad, Brian?
She's
That
a
Oh, yeah, I
planner.
know.
She's a planner to the nth
Yeah.
degree. That's
I know
Birthday planning. Right. Yeah.
when he quit, he was like, "Oh, I wonder who's it going to be." And I said, "Well, I guess technically on paper, it's me right now." But
okay. Well, hopefully the interview goes well and we don't have to think about it again.
Yeah, Amy, I will reach out to you though if we need to keep talking about that. Okay. So expansion of inspectional services. I sort of want to just keep this like in the update sort of ongoing as we, move forward over the next several months. I already mentioned that I'm in the process of getting my RS. Hopefully we will have that part-time position approved, on like tonight. That'd be great. Just to reiterate, we're wanting to move to an electronic permitting system, digital software to conduct inspections, which will just increase the efficiency. So hopefully adding the new staff position, having me able to spend kind of like a backup on inspections as needed, and then having electronic software that adds a little bit of efficiency to the actual inspection process will be enough efficiency to get us up to 100% inspections for the next year. Amy, go ahead.
Are we paying for the software, or is it part of our agreement by being in the shared service program?
So I've been told from the PhD at Northampton that we can be part of their like group subscription for no cost. But from what I understand, they haven't identified or they haven't initiated that software yet. So I will reach out again because I wasn't clear if they were like already using the software. They said, Lauren Davin is the person I talked to, and she said, I think that they were waiting to hire the shared services inspector to get that piece going. I could be wrong about that though. This is a conversation we had maybe a month and a half ago.
Yeah, I mean, depending on which software you buy, because the two softwares that are the primary softwares across the state vary widely in cost, and one of them is very, very expensive. And if we can get one of them for free, that would be great, because the state is going to have one for free available in the next 2 years.
Oh, wow. Oh,
so
nice.
in the software, we'll be able to do all permitting, all inspections, all complaints. It'll have all modules built in. People will be able to file complaints right on. I mean, it will be a one-stop shop for all local public health in terms of any computer needs. So like to buy into a big system now, when we have one for free, when one is coming also for free, that has incentives behind using it, it might be better to use the free one.
Yep.
Yeah, thank you for letting me know. That's great. So initially we were looking into purchasing software, but then the PhD folks let me know that we could get access to it for free. So that's sort of the plan. Once that is like more available to us, we'll get online with that. Hopefully by the time we have the part-time person added to the crew.
That way, when we do have the free one from the state, we'll have all of this data to pre-populate in there. So we'll have all our historical records that will be already in electronic form. So we'll be in a really good shape.
Yeah, that's great news. I'm really, the state has like super been stepping up on like the regional resources and that are funding the public health. It's really good news. And then let's see here. So the mayor recommended sort of incrementally over the next few years, increasing our permitting fees to sort of match with the staff time that's required to respond to and process permitting and doing inspections and things like that. It's a tough one when we compare our fees to other communities because we do a risk-based fee schedule and most other communities do sort of like an activity-based or like category-based fee schedule for their restaurant. So, for example, the more high-risk establishments have a more expensive permitting process. But there's certainly areas we started a little bit of an analysis of our costs. And one thing that really stood out to me was the camp inspections and permits being like $250. And I know, Brian, the amount of time it takes for the inspector and the public health nurse to do the camp inspection probably is a lot beyond the $250 for staff time. So this is my plan really was to sort of come up with like a stepwise proposal for the board to review next month that would show sort of like the incremental change of increasing fees by a certain percentage, probably 10% year to year, but focusing on the permit areas that require a lot of staff time but are currently low fee. What are all your thoughts on that? And I'm just curious for your input. That can be complicated to increase fees in a community.
Yeah, well, Amy knows there hadn't been a fee increase for quite some time when Bree took over. We got a lot of flack from people when we increased some fees, but I agree with some kind of annual, like it doesn't have to be a huge increase, 5 to 10% or whatever. But that's a good point, especially about camps, because I just always hear you guys talk about how it's camp season and how burdensome that is. I would just be curious to hear if there are any other, and we can break it down like average time spent on doing a camp permit between Brian and Christine. And I don't know, Amy has more experience with these things, so she'll probably have more of a.
Yeah, I mean, if camps are done right, they're really time consuming. And for the camps that run consecutively. So when I was in East Long Meadow, if you had a camp that ran 12 weeks in that summer, we went out once every week to ensure the new campers came in, also met all of the things we looked for that first week. That's not done everywhere. And I don't know if that's done here, but if it's not, maybe that could really justify some of the increases that we're going to start doing this, because every week it's a batch of new campers. So if you don't have all of the paperwork or the stuff, like the week, you could have all your paperwork done for that 1 week, that startup week, and then not for the rest of the year. But if you're not going once a week, you're not going to know that. So I think we could certainly justify an increase in the camps. I wonder, it sounds like this was at the request of the mayor, and I wonder if the mayor does know that we increased this, a 2-year increase within the last 3 years. So I think we would want to and I think we went to if not to or above some of the surrounding areas. So we might want to really just do another quick scan of the people in the region and see where we compare, because some of those increases were quite large because it hadn't been done in a while. But to have what we had just done and then also now start looking at another increase, I'm not sure. That's what we want to take. We don't want to scare people away, especially the event vendors and the restaurants and things like that. But I think there needs to be a look-see for sure. And that's one of the great things the licensing inspection software could help do, is justify and validate the time that Brian's spending on these things. It would be Brian was of the 52 work week, he spent this many time in restaurants doing inspections or re-inspections. we're allowed under state law to charge what it takes to do this work to help support the safe running of these restaurants. This isn't even covering 50% of Brian's salary. So we will have data behind this if we start using that inspection software.
Yeah,
That'll be
absolutely.
helpful. That'll be great.
That will be really great. Yeah. I wish it was available right now so we could like use this as we go forward. But so
we could do the low-hanging fruit right now. We could do that low-hanging fruit, the ones that are very clear and obvious, and then ask the mayor for a year to like really look at the rest since we just increased. Like the tattoo shops, there's no way we can add another increase to them. There's no way.
Okay.
They'll all leave.
And it's not fair. I mean, we did just give them quite a large increase, and it was a justified increase, but to them to throw another increase, it will feel like unjustified.
Yeah. Yeah, I hear that. And, we'd want to do it like very small incremental increases, like over a set period of time too. Like I wouldn't want to do really anything more than like 10% year to year. But it also, the fees also have to like logically make sense with like the staff time it takes, the fact that the city's adding in an additional part-time inspectional position. So I might reach out to you all individually sort of as I get this like analysis and like proposal done over the next 4 weeks before our next meeting. So if you hear from me and Amy, especially with your experience in local public health too, I might look to you a little bit more. Are you able to hear me? It looks like I might be stalling on my.
Hear you fine.
Okay, great. Okay. All right. So we will plan a real discussion around a proposal for potentially increasing fees beginning in next fiscal year, next month.
Okay.
Let's see. We have our flu clinic coming up. We have our public flu clinic coming up on Saturday. And then we have a council on aging clinic coming up next Wednesday, and then our municipal clinic on Monday. We're also planning a public COVID clinic, hopefully located at the Easthampton Congregational Church, which is a new sort of partnership with the city. It's a really good downtown Main Street location. It's like right on the bus route. They've got fantastic parking, a fantastic large room for us to, that's like well climate controlled, very comfortable, very accessible for us to hold a clinic in. So it would be a new spot for the health department to hold a clinic, but we wanted to try it out this year just to see if we could like bolster that partnership a little bit. And so the church has already approved us, and then we're just working with the regional team in Northampton to confirm a date, and then we'll start advertising the COVID clinic.
Great.
Yep. Let's see here. And then tobacco violation. So thank you, Brian and Jackie, for letting me know. Valley Farms did pay their fine. But they have indicated to us that they may potentially do a judicial appeal. They seemed, and Brian, maybe you can speak to this a little bit in your update or now, but it seems that they were primarily focused on appealing the violation from the Department of Revenue where they were operating on a 90-day suspension of their tobacco permit during the inspection by the Pioneer Valley Tobacco Coalition, which was not a violation cited by us. We can't cite a violation on behalf of the Department of Revenue. And Brian did let them know that, not on us, that would be appealing with the state. But there did seem to be some confusion of what their process would be moving forward if they wanted to appeal or not. Brian, do you want to add to that since you just spoke with the vendor?
Yeah. It was due, the original, the fine was due originally on the October 6th. It was 21 days after, they received the order. And, it was roughly about a week overdue. So I contacted the owner, over the phone. And, yeah, you know, it wasn't an argument, but we got a little bit of a heated discussion. But I think he was expressing confusion over appealing for the state, and that he wouldn't have to pay the fine while he's appealing. And, I, reiterated to him and informed him that, that the city had nothing to do with the state violation, and that wasn't included on the cease and desist order that was given to him. After that conversation last week, I was completely under the impression that they weren't going to pay and that they were going to move forward fully with an appeal. So I was caught off guard earlier this week when a representative came in and handed me the check. So it was nice to not have to, worry about that. Their suspension does start Thursday, or tomorrow. So I know Allison and I plan to go out tomorrow early afternoon to do a quick inspection, because we've informed them that they have to have everything removed off the property. And I know Allison marked it on her director update that we plan to go out at least a few times during the 30-day period, just to ensure they're being compliant.
Now, does the tobacco coalition person, what's her name?
Donna,
does she also go out?
From my understanding, that they will go out, but I'm not 100% sure if they'll go out like automatically. We might have to request them.
Okay.
Yeah, they go out and they do their like routine educational and like compliance checks, but I'm not sure if they consistently do like re-inspections on suspensions that were put in place by like the local boards.
Us, yeah.
Yeah.
So I did request somebody from the Pioneer Valley Tobacco Coalition to attend one of the periodic inspections over the next month with us.
Okay.
But yeah,
I just didn't want you to overlap with them, and just coordination if they were going out too, but it sounds like it's primarily us, or you and Brian. Yep.
Yeah, generally, Meredith O'Leary told me that it's primarily up to the community to do the re-inspections and then to do the violation notices and fines and things like that, and to enforce that side of it, to respond to the Pioneer Valley Tobacco Coalition inspections. But we can request them. We can also ask for their advice sort of as we go through. So I'm not super confident that they'll have everything off the property for tomorrow. So we'll see. I mean, if
I think it's worth it to ask for request for one of their inspectors to go out. They're trained in this. They're a neutral party. They're not part of us. They have no interest in like catching them in anything. They're also like, just this is kind of what she does. So asking them to go out and inspection, I think that's part of the benefit of being in a regional program.
Amy, do you think we should have them go out before Brian and I do an inspection? Like, do you think we should hold off until Pioneer Valley gets for an inspection, or?
No, I think you guys should go first. And then send them in. It's a 30-day suspension.
30 days. Yeah.
And then like mid suspension as their follow-up.
Great.
Because you guys are going to say, okay, we are about to start. I'm validating that there's nothing on this property, and then we'll have documentation. If something were to arrive on that property after you guys were to leave, we'll have a neutral party have documented that.
Great point. Yeah, that's a great point. Yeah. All right. And I think that's the end of my director's update.
Okay. Brian, I think you're next.
Yes. I don't have too much to go over. I had a section about tobacco, and it was about Valley Farms not paying and possibly doing a judicial appeal, but I think hopefully we can scratch all of that. I just kind of briefly wanted to highlight with our food inspections. So conducting them has been definitely a real challenge this year. Between the vacancy, the permanent vacancy, the vacancy of like a permanent director until Allison came in. And then just recently, we've had an increase in housing cases, and we had a house fire on Gough Street last week. That we had to condemn, and it displaced a family. So a lot of focus and attention has been on that. And then we just had 2 septic system inspections that are going to be coming shortly as well. So it's definitely been a challenge getting out there. As of right now, I'm on track to be able to squeeze at least 1 inspection for each establishment. But again, depending on the wave of cases and other needs where my attention would have to be put, that might affect that. So hopefully I can get out there to at least each establishment at least once by the end of the year. Okay. For new establishments, for food establishments, Big Bear Books Cafe recently closed, and they were in the Keystone building. But there is a new local food business moving in there. A business by the name of Vegan Pizza Land. He's from Easthampton. He started, within the past year, I think last summer, maybe 2021. And he was like a temporary food vendor, and he was setting up at like the brewery. He frequents abandoned building pretty often. And then he transitioned to a mobile truck this year. And then he's going to be using that as his kitchen for the mobile truck and the temporary food operation. I think he eventually plans to make it like a brick and mortar type of store too, where you can actually have people come in.
I'm surprised he doesn't go into riffs.
Yeah, well, that place is huge. I think it's just too big for him.
Too big for him. Yeah.
It's a pretty small operation still.
Yeah.
But I'm over the past year and a half, he's went from a tent to a truck, and now he's got a kitchen. So
they've totally exploded. They've become really
their
popular.
Pizza is really good.
It is really good.
I haven't had it myself, but I've heard good things. I've heard even people say that even people who are not vegan and typically don't eat that type of food, that it tastes really good.
It is.
Yeah. So we had 1 establishment leave, but 1 will be shortly. We're filling in that spot. For housing cases, so 26 through 28 Federal Street finally just sold last week.
Boy, that took forever.
Yeah, it took quite a long time. Yeah. And I was going back and forth with the bank. I was checking in pretty frequently every couple of weeks. And, but the new owner reached out to us earlier this week. I connected with him. So the fly problem, as I believe I stated at the previous Board of Health meeting, the fly problem has stopped. They've actually have already pretty much cleared out all of the vacant unit. And when I did check in with the occupants last month in September, I did observe some water damage and some mold growth in their kitchen. So I did spoke to the new owner this week, and I sent him an order for that, and they seem like they'll jump on that right away. So it seems like problems with that property will seem to soon be fully cleared up. And as I explained earlier on last week on the 17th, Goff Street, there was a fire that was inside the home, but thankfully isolated to the second floor due to the fire department. On the 19th, Allison and I went out there, did an inspection. We were with, the fire department. We had Emma from the police department. She was out there. She helped since Liz wasn't able to be out there. And we are also with BJ, the building commissioner. So BJ, she had concerns about damage and safety. So she pulled the electrical panel off the house. So due to the damage and the electrical, the lack of electricity, we did have to condemn it. But I do know that, and I've communicating with Allison, the family's gotten a lot of support through their insurance, through Liz. She was fortunately able to jump back onto helping out with us with this kind of stuff last week, and she's also they're getting aid from Robin at the community center as well. So, so although unfortunately they had to be displaced at least temporarily, they're getting the support, and Liz is staying in contact with them.
Okay.
Yeah, and that's pretty much it. That's all I have on my update. The other section was about tobacco, but we already covered that.
Okay, sounds good, Brian. Just do the best you can for the rest of the year. Hopefully we'll have good news tomorrow.
Yes, yeah, fingers crossed.
And I think just to add to that too, so obviously I've only been with the department for a few months, but it does seem like I would love to make the social worker position permanent at the city, sort of just like looking far into the future. It's a 4-year position, ARPA funded for the time being. But just with the number of housing cases and housing complaints we get, I mean, Brian, we probably get, at least 5 a week. Or maybe not that many, but sometimes it's like 8, sometimes it's like 1, but I feel like Brian is often going out to observe like trash hoarder situations, and we definitely call on Liz very, very frequently to assist with these cases and to conduct a follow-up. Especially with this fire situation, it's shown how critical it is to have the social working aspect to it all. And luckily the family who does have complex health conditions and are, elderly folks are in a safe and comfortable long-term temporary housing situation while their house gets fixed or the issues get resolved.
Yeah, I mean, we'll just have to figure that out in the budget for next fiscal year. Hopefully there's some room for that, because you're right. There is, and as people age, and it's happening in this city, especially, there's a lot of elders in this city. So, yep.
Definitely.
Okay. Next is Christine Southworth.
Christine, you're muted.
I should be off, right?
Yep, you're on.
Okay. So, what did you want me to talk about?
So I thought we might just talk about, a little bit about how you've gotten into the community and so Kristen has been just with the department for just about a week. IT is still not completely set her up with her computer, cell phone, all that. But Christine's been able to get to the Council on Aging. You went to the library, right? With, yep.
And then I went to the community center yesterday.
Yep.
So,
Great.
Yeah, so get out to the community. Also, Christine will be the city. We'll be repping the health department at the flu clinic coming up on Saturday, and also be present at the municipal clinic on Monday, Wednesday, and yeah, Christine, do you want to talk a little bit about some of the ideas you had for like a health fair and community hours at the Council on Aging? And yeah, I mean, it's just all sort of very preliminary, but I thought it would be worth sharing ideas with the board at this meeting.
sure. I thought maybe a health fair in May. I was talking to Allison the other day, and we were talking about that same church hall that is really huge and a lot of parking over there. I just, it probably takes a good 3 months to get it all put together, but I'm going to start compiling a list of some supportive agencies. I think there's like a wealth of them in Easthampton, and I think I didn't know. I had no idea there were so many services, and I live 15 minutes away. So I think, I really think it would be eye-opening to a lot of people. And then as far as the library, she said she doesn't have like a lot of space there, but we did talk about the Bite Lab from the DPH, setting that up maybe in April, for the children's library. And she was talking about maybe doing hours. I guess Liz used to do like a weekly, or was it bi-weekly or weekly?
I think it was bi-weekly.
Yeah, I think so.
Be there to help people with questions and that kind of thing. And I asked about doing like an informational like area, but I don't know if you've ever gone into the library. The space is like really premium.
Very cramped.
Yeah, it's tough. So I don't know about there, but probably at the Council on Aging, I would think I could set up some kind of, monthly wellness, health and wellness kind of info station. And we were talking about the town hall, but I guess that's a process to get flyers up and that kind of thing. But, I think the more information, the more places, more people we can reach.
Yeah. Great ideas.
So that's kind of what I'm looking at right now. Yeah. I'm supposed to meet with Taylor tomorrow, but I just canceled it because I'm working on the Facebook info.
Taylor McAndrew.
Yes.
Yeah, Christine, I can take on the Facebook piece if you want to keep that meeting with Taylor. But either way, you can always.
Yeah, that's okay. I figure I'll go in tomorrow, and that way. Are you going in tomorrow?
I am, yeah.
Yeah, and then that way, maybe anything that I have questions with, I'd be able to, touch base with you there too. So
Sounds good.
Yeah, that's about it so far.
Sounds good. Sounds good.
Good.
Any other items that people didn't anticipate?
Oh, yes, I do. I have one. So Bree reached out to me, and as part of her training with the FERCOG and being the lead trainer for the regional inspection. I don't know what her title is, but she's the lead trainer for the regional.
Regional field training hub.
Yes, the training hub. Thank you for that. I don't know why that term wasn't coming to my head. So as part of that position, she is being essentially trained and needs to be shadowed by the state lead inspectors. And she asked if, because of she needs to inspect,
Hi, Sarah.
establishment that operates under a HACCP plan, and then also another type of inspection that I just don't have it in front of me. And she could do those established. So FERCog doesn't have those types of establishments in their region that they cover. So she asked if we could come to Easthampton and either just do an informational inspection as part of that training program for her position, or if the board wanted to appoint her as an agent, it could also count toward their inspection count in that case. So I'm comfortable with her coming into Easthampton, of course, and like working with a state trainer in the city, but I just don't know if the board will have to reappoint her as an agent in her new capacity. I think probably yes. Although she was an agent with the city for years, so I'm just not sure about the process.
Legally, if she's doing an inspection in our community, she would need to be an agent appointed by us for it to count for anything, even if she was an inspector for 2 days prior. Will she be shadowed by one of the state trainers while she's in? Yeah. The state trainer she's going to be with is Mark Carleo.
You never officially undid her as agent of the board.
Were we supposed to?
I've never done that.
Yeah, when you resign, you don't. I think you would only do that if you're going to force someone out somehow.
Okay.
I love Bree. Mark's going to be great. I love using our community. I'm conscious of using it as an official inspection because it might seem as though we're picking on that whatever establishment we pick, right? Because you're going in there.
Good point.
With a regional trainer and a state inspector, and they're going to feel like they're being ganged up on. Like 2 people are here doing. There's going to be feelings around this, and if it's a much different thing to like walk in and say, "Hi, you know me. I'm here being trained. This inspection will not count, but you will have all the benefits of knowing what we found during this inspection." It could be like something that's seen as really positive and a benefit versus something that feels like we're sending 2 inspectors in, and one of them is from the state, and they're going to get fined so much more than Brian would have found, which I'm sure is not true, Brian. I'm sure you find everything, but it could be perceived.
It'll seem that way. Yeah.
Great
point, Amy. Yeah. Because I was thinking, oh, that would be great. One less for Brian.
Why, Brian?
Sorry, Brian.
All right. I agree with that for sure. Yeah.
Okay. And that would be on November 9th.
Okay.
So does the board want to take a vote on? Oh no, because it would be an informational.
We're not gonna appoint her to anything.
Yep. Great.
And I mean, I think we should just make sure Bree, I'm sure Bree would do this anyways, but she's asking permission. When she approaches, it is like, I need to be standardized. This is the state trainer. This will not count as anything. Can we use your facility to do this? It is a question and a favor being asked. And here is the benefit for you. You get this wonderful report of everything that I've noticed ahead of when the town and city inspector comes to find it themselves. If someone says no, she should just walk out and find another establishment. I mean, we have enough of everything that she should be able to find someone who's willing.
Yeah, I'll make sure to communicate that with Bree prior to the inspection day.
I know where she won't go.
I know where she won't go to.
Oh dear. All right. Anything else? All right. I guess, do we want to make a motion to end the meeting?
Before we do that, can we talk about the November meeting? Because I know it's around the holidays, so I just want to make sure November, December are going to be as planned. Because I do schedule things out quite a bit.
So I think our November meeting is on the 15th, but I know it's Thanksgiving early this year. Oh no, it's the week before Thanksgiving.
The 15th.
15th. Yep.
Okay.
Meeting's on the 23rd.
The December meeting? Yeah, so that won't happen.
Oh no, December is the 20th. December's on the 20th.
Okay.
but I'm not, we can cancel December. It is pretty close to the holiday.
I mean, I think we could, it's not the week of the holidays. I think I'm fine holding the date. So if anything does come up, we have it.
Okay.
And if we get close and nothing's happening, we can just cancel it.
Yep.
Okay, thank you. Sorry. Now, if anyone else has an agenda, I've dismissed the meeting.
Yeah, I'll make a motion to end the Board of Health meeting at 6:26 p.m.
I'll second.
All in favor, Maggie, yes.
Amy, yes.
Beth, yes.
All right, meeting is closed.
This government meeting is brought to you by Eastworks and our local cable subscribers.